You are an FI1 working for a general surgical firm. Your hospital is currently carrying out monitoring of doctors' working hours. As your firm is busy, you are working overtime during the monitoring. Your consultant asks to see you and tells you that if you reveal the extra hours you are working, then you would be putting the department into trouble. She asks you not to put down these hours. Rank and order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Put down the true hours, including the overtime, that you have been working without telling your consultant. B. Say that you can't be dishonest and put down the true hours. C. Put down the false hours, not including the overtime. D. Seek advice from senior colleagues. E. Seek advice from the British Medical Association, BMA. Answer B, D, A, C. As a young doctor, it is hard to question or challenge practice that seems to be taken for granted, especially by your senior colleagues. You must remember that you have your professionalism and integrity to uphold. The most appropriate option is to tell the consultant that you cannot be dishonest and put down your true working hours, B. You may feel unable to do this, so the next most appropriate option would be option D, to seek advice from senior colleagues about how to handle the situation. Seeking advice from your professional advocacy organization such as the BMA, E, may be required, but it would be best to talk to colleagues within your department first to voice your concerns. Putting down the true hours without telling the consultant, A, may be appropriate, but your consultant is likely to find out later, and this will not stop the consultant from putting pressure on your other colleagues in the same way in the future. Claiming you have worked the false number of hours, C, is the most inappropriate option. Not only is this unprofessional and dishonest, it will not help the department in the long term since it is likely that you and your colleagues are being overworked and need more support with staffing levels. You are working on an audit on consenting for hernia repair surgery. You are working with your consultant, and it is becoming clear to you that the department is not performing well regarding informing patients of the risks. You are only involved in data collection, and your consultant is doing the statistics. When he presents the audit at your departmental meeting, it shows that the department has done extremely well and gained a financial bonus from the trust. You cannot understand how this has happened as it was very clear to you during the data collection that the department was failing. Rank and order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Analyze the data yourself to check if your consultant's conclusions are right. B. Ask the advice of a senior doctor you trust about how to take this further. C. Ask to see your consultant after the meeting to ask how the department had done so well when you thought it was failing. D. Assume you must have been mistaken in your conclusions and congratulate the department. E. Send an email to the trust, containing your data, asking them to look into this audit in more detail. Answer C, B, A, E, D. The assumption in this question is that the consultant has been dishonest and altered the results of the audit to gain financial reward from the trust. This has patient safety implications since, instead of learning how to do better, the department thinks that it is already excellent. The best response here is option C. You did not do the data analysis and could have made a mistake in your assumptions that the department was failing. Option B is the next best response. Dishonesty for financial gain is a serious allegation, and a senior doctor would be able to offer advice about how to investigate this potential case and which channels to use to escalate the issue if need be. Reanalyzing the results yourself, A, would offer you a way of testing whether your conclusions are actually correct, taking into account that different statistical methods can yield slightly different results. You would then be in a stronger position to raise the alarm if you find your suspicions to be correct. Sharing your concerns with the trust, E, is the next best answer. As part of whistleblowers' protection rights, you should be able to send named emails without fear of repercussions, and it would be easier for them to investigate using your data if you did this. Option D ranks last as turning a blind eye to this shows a lack of integrity and morality.